WWT presents Partner Spotlight.
I'm grateful to be joined today by Troy Ament, who leads the healthcare practice at Palo Alto Networks, and Dr. Eric Quinones, who serves as WWT's Chief Healthcare Advisor. Troy has roughly 20 years experience in healthcare, overseeing clinical technology implementations, and has served as Chief Information Security Officer for two of the largest health systems in the United States. Dr. Quinones has helped organizations ranging from the military to Fortune 500s to startups bridge that gap between clinical and digital to help them achieve care delivery outcomes. Dr. Quinones works with our clients to help them achieve the quintuple aim, and that is improving outcomes for patients, populations, and clinicians while improving the cost of care and health equity. Troy, Dr. Quinones, I really appreciate you joining me today.
Thank you, Jake.
Thank you, Jake. Great to be here.
So let's level set on the state of the industry right now. What types of challenges are you both seeing healthcare CISOs face? Dr. Quinones, do you want to start?
Sure. There's a lot of challenges that CISOs are facing today. So obviously increasing cybersecurity attacks, evolving cyber threats, resource constraints, and integration of cybersecurity across the organization they may be serving. So, if we think of increasing, cyber attacks, that has been really a huge challenge, particularly in ransomware attacks. The FBI noted in 2023, they saw ransomware attacks increase by 18%. Geisinger had a breach over, I think, 1 million patients in November of 2023 from a former Nuance communications employee who is now facing federal charges. Change Healthcare, a third-party clearinghouse for revenue cycle management, which works with many providers and payers, was attacked in February, and that impacted the lives of over 100 million patients. These attacks severely impact patient data security and hospital operations. When hospital systems are compromised, in ransomware attacks, appointments and elective surgeries are canceled. ERs divert those patients to other healthcare systems. Patient care comes to a halt, and as clinicians are working in the dark. So this directly impacts patient outcomes and the business of providing healthcare significantly.
Yeah, maybe just building upon that, Dr. Q, the adversaries are really learning about the entire ecosystem of healthcare. They're learning about how health systems have become electronic and digitized over the past decade. And to some degree, how soft of a target some health systems are because of things like mergers and acquisitions, taking on a lot of technology debt and having, a really vast ecosystem of electronic medical records and other systems that depend upon to, provide patient care. So these adversaries are learning more and more about these environments, finding the soft spots, the weak areas within these health systems, and have found different avenues to spread their ransomware, which is significantly disrupting patient care. Whether it's in the beginning, communications, whether that's overhead paging of, rapid response teams, all the way to being able to provide medications, do revenue cycle management, staffing and scheduling of clinicians, really across the board.
Yeah, exactly. I think you hit it on the head. As we've seen, mergers and acquisitions become a very normal process in the healthcare industry, and it's not like flipping a switch. It takes a lot of time to actually bring the two or more systems together to be literally on maybe the same platform or to even have the same processes in place. So it could be very disrupting just from a clinical standpoint, because the technologies are different. But for a CISO, it can be extremely challenging because there are a lot of vulnerabilities. There are a lot of medical devices that they just may not be aware of. The technologies themselves, as you mentioned, it may be they may be suffering from tech debt, or just older technologies that you can't even update those systems. So, there's a lot of vulnerabilities when you see those M&A activities happen. So they have to be mindful of that. I think, and then also, with emerging threats we're seeing, cyber criminals are constantly evolving themselves. I mean, they're using, very sophisticated tools. So if are an easy target, it's really hard to combat those with, sophisticated tools like AI cyber breach tools and things of that nature.
You both mentioned an increase in complexity from the cyber bad actor side as well as complexity within the health systems environments. How can healthcare organizations streamline their infrastructure to better protect against these evolving cyber threats? Troy, your thoughts?
Yeah, I think foundationally, one of the things that I really advocate for, and something that was really a positive in my past, was having really good governance within an organization. And that governance can be from, we hit on this a little bit earlier, but mergers and acquisitions. So being really diligent about reducing the complexity to, really streamline the organization, not only from a clinical perspective and revenue cycle perspective, but also from a cyber, viewpoint. So, as a former CISO, I managed over 25 small and large acquisitions, and the biggest tool in my tool chest was an organization that really believed in governance and consolidation. And so that helped me out quite a bit. We would move from having 5 PAC systems or multiple EMRs, to having one centralized, electronic health, ecosystem. And for those organizations that become holding um, you know, companies for a number of health systems and don't build upon those synergies, don't reduce that, footprint, it becomes, I can't even imagine, very challenging for a CISO to not only have a good inventory of what's out there, but then, set up your security infrastructure and have one security infrastructure, right? One platform that you have complete visibility into all of your environments, all of your endpoints. That's hard enough, just having one solid platform to build upon. But then if you're having to defend multiple borders with, different ingress and egress points, different electronic health records, different teams, I think, can't forget about the people aspect of this as well. That's foundationally, those are some of the most important important pieces, is to do that consolidation, to have good asset management so that you know what you're protecting. Because if you don't know what you're protecting, the adversaries are going to be very hard to defend against.
Yeah, I agree, Troy. I mean, again, the enhanced cybersecurity measures, adopting, emerging technologies. Another thing I would add is, education and awareness. I think that's really critical. So I think CISOs are focusing on educating not only their IT teams but the broader hospital staff as well. About the importance of cybersecurity measures. What's the WIPM? What's in it for me? Right? And if they don't understand, why they're doing what they're being asked to do, the engagement may be low. So, having, very a clear understanding of what the organizational, goal is, and what it means to the departments and what it means to, the patients is, I think, very, very important. So continuing that education and making it just part of the culture is very critical. Again, I think, better than I do in terms of, your as a CISO, former CISO, just the one of the easiest points of attack is, or vulnerability is, the individual working at the organization. I mean, maybe I'm wrong, but you tell me.
Yeah. I think that's a very good point. And, when you talk about that education across the staff, a lot of times health systems, I'll tell one story from my past. Our organization, we had a number of CFOs or regional controllers that were all targeted at one time. And, the good news is, well, as 5 of them were targeted, there were a couple that raised their hand and said, this request, this wire transfer doesn't look legitimate. And because that person raised their hand early, They said, this doesn't look right. I had a discussion with our CFO. She would have told me this in person. Because that person raised their hand, it really got our threat hunters, in an actionable point, and we're able to stop a major, fraud case against our organization. We were able to respond very quickly, and that was all about, user awareness and someone, raising their hand and saying, this looks like a threat. This looks like, a phishing attempt, spear phishing. And sure enough, it was, and we're very, very close to a, significant incident.
You both mentioned the importance of people and process with the data governance, but I want to focus a little bit on some of the new technologies. Health systems are looking to adopt AI and cloud initiatives for the major impacts they can have on patient and clinician experience, but that data protection is still top of mind. How should healthcare leaders be thinking about data security with the context that there's just so much data out there and it's often moving from environment to environment?
Yeah, maybe I can start. So I think any new initiative, whether it's AI or going back to cloud, 10, 15 years ago, foundationally having good governance, whether that's a third party that you're partnering with to, share data, have them process data, utilizing AI, doing third party risk assessments, making sure that your security technologies that you're currently using will fit into that new digital transformation, right? For my security teams, having the same tools, the same visibility across the new technologies is very important. So if you're utilizing a security operations center platform, if that new technology or that digital transformation doesn't fit into your current platform, you should really question that platform. You should question that vendor to make sure that you're not creating yet another widget, another security tool, or another process for your teams and creating more complexity. To that end, it's very important, like you said, that your processes remain very consistent. And the technologies that you're using remain very consistent. That's something that I really coach. Doing those third-party risk assessments. As we're talking about AI. I did some research last year about some of the top AI companies out there. And, a lot of those are startups, and their security maturity maybe isn't their top priority. Maybe their organizational growth or innovation is more important than security. And in all of those incidents or projects, you're looking at huge amounts of data moving from a health system that's, highly regulated, going to an organization that you don't know much about. So doing very comprehensive third-party risk assessments when you're handing that data off and making sure that they understand, what, a shared, cybersecurity, play looks like for your organization.
Yeah, so I'll add to that, Troy, and it's a good question, Jake. I think for us in healthcare, data is gold. It is completely gold, and finding the data at the right time, regarding the right patient, the right data at the right time regarding the right patient. That's just epic. Healthcare generates 30% of the global data. If you didn't know that. And then next year, it's supposed to be in 2025, 36%, I believe, of the global data. Mining that data, to drive clinical insights in order to move, towards more proactive, personalized well care, will require paying down technical debt, to move into a high performance architecture, strong data and AI governance wrapped around vigilance of a cybersecurity program. So I think that's important. But what are they doing? They're establishing a secure culture, regular training staff, on cybersecurity best practices, with top-notch protocols. That's what I'm seeing. A lot of our clients do today. Identifying, to identify offline department leaders as well to help run, tabletop exercises when and if systems do go down. So being prepared. And then also, protecting mobile devices is through encryption and implementing those strong authentication measures as well. Very important. Also making sure that iOS and, OS operating systems are being updated with the appropriate antivirus and malware tools. And then also, making sure that they're implementing strong access controls as well. Securing the IoT or MIoT, as we call it, medical Internet of Things, through network segmentation and regular patching, as I kind of mentioned. Limited network access through secure firewall protection, and making sure that folks that are getting into the network are using appropriate VPN tools. And again, encrypting the PHI data. Many of our clients, I think, as Troy mentioned, they're using these tools. Well, many of our healthcare clients are actually using, WWT's, Advanced Technology Center to actually assess these tools, along with our cyber range and AI proving ground environments to assess whether, the current state, is, in relation to cyber threats and, what steps they need to take to promote a more proactive, vigilant cybersecurity posture. Our clients find these tools invaluable because it allows them to get through, the desired solution faster with quicker iterations. It's saving time and money. This is something that we don't have a lot in healthcare.
So there's a lot of opportunity here. I was maybe a little bit of a downer on the AI side when I was talking about the innovation, but there's going to be huge advancements from a patient care perspective, and this is going to be all good at the end of the day for patients. They'll bring a lot of risks that we need to mitigate, but the other side of it as well is on the security operations center side. So we've known for years there's been a significant challenge with regard to having enough skilled employees to fight against the adversaries, and we're at a point where we talk a lot about this at Palo, is fighting AI with AI. And I think that creating some automation with some of the new AI tools and co-pilots is going to really help some of the healthcare information security teams, maybe get one step ahead or move towards one step ahead of getting better visibility, but then, doing more automation and orchestration and being able to trust AI to look at visibility in different ways. That's something that we're certainly focused here at Palo, is really fighting AI with AI, because if we don't, the adversaries are going to use those tools to really impact, patient care.
Well, you both have extensive backgrounds in healthcare technology, and I'm sure you both agree that the healthcare security vendor space is becoming increasingly crowded. How can health systems start to cut through some of that noise with the vendors and scale their security teams with automation? Troy, do you want to start?
Yeah, sure. So I think that when we look at this, I look at it when I used to lead Epic implementations, and one of the big advantage of leading an EMR that's a really comprehensive package is scale and really simplifying and having a lot of integration there. And I feel the same way from a platform perspective as I did with regard to electronic medical records. Before, we had really distributed systems and point-based solutions from an EMR perspective, whether it was lab systems, radiology, and even inpatient, outpatient systems that used to be systems. It's the same thing that's happening in cybersecurity. We're seeing a lot of platformization, which is creating synergies of automation within those tool sets. It's creating economies of scale to reduce costs. So that's where I see a lot of the benefit. Not only from a cost perspective, but then, when I look at my old teams, my security operations center teams and my engineering teams, these aren't large teams. In my organizations, they were 50 to 100 within our information security teams. And being able to cross-train people so that they could use multiple tools, have the same sets of, dashboards and tool sets so that they could, we could be more efficient as a team. Very important, very important. And that's where I see some of the, I think, advantages of organizations that have larger tool sets like us at Palo, that organizations can, not only reduce their costs from, utilizing one vendor that has a complete incident response team, but then also having teams that are much more efficient.
Yeah, I think that's a good point, Jake, there's a lot of vendors out there, and I think, it can be quite disorienting for sure. One size does not fit all. And that's where I think our advanced technology center comes into play, for our healthcare clients. They're able to replicate their IT environments and run various labs and scenarios, and that helps them to compare and contrast, what they may currently have or what they're considering, in terms of a decision that they may have to make when they're considering their cyber environment. For example, some of our clients, they definitely do, endpoint protection automation drills within the ATC, IT task automation for patch management, vulnerability scanning, configuration management, automation in those areas as well, which helps reduce it. It helps reduce human error. And establishing a zero trust framework with automated access controls and continuous authentication, automated incident response for incident detection, analysis and response workflows are very critical in terms of being able to automate those processes. Data encryption automation tools as well. I see our clients using those things, and asset management automation tools, to maintain an up-to-date inventory. That's a big problem that a lot of organizations have. They just don't even know what they have in their environment. So being able to automate that to bring a more clear, line of sight where they currently stand with vulnerabilities is important.
We're talking a massive influx of third-party vendors, but there's also been a massive influx of connected devices in the medical field. I mean, many of us have Apple Watches on our wrists that can now monitor our health data. So how is the industry working to ensure that these IoT devices are secure? Troy, do you want to take this one first?
Yeah, a number of us did a lot of work on Capitol Hill over the past decade and a half, or decade, I would say. And so we've got a really strong framework. That's it's called the Patch Act that was passed. We're almost 2 years past, right? But this is going to take some time because a lot of health systems have deep investments in some of these big iron connected medical devices. And the cybersecurity or the life cycle of which these are developed start years before organizations buy them. But the good news is the new devices that are going to get approved by the FDA, and there's some new regulation coming across EMEA as well. We're going to see medical devices that are now approved that have a cybersecurity life cycle. We have complete visibility into their software bill of materials, which includes the hardware components, so that, like Dr. Q said, we have better visibility and a better understanding of what assets that we're ingesting into our organization. It wasn't too many years ago that we've had, deep vulnerabilities within different parts of medical devices that, organizations just didn't know what components were in different devices to know how vulnerable their organization was. So, to that end, these medical devices and these connected devices, whether they're wearables or they're things that are happening within like digital pathology, these are huge advancements for patient care and are going to mean a lot of good things for early diagnosis. But to that end, good news is we now have formalized regulations so that, cybersecurity is definitely in the approval process from an FDA perspective. We've got good guidance from them and regulation, but it's going to take some time. It's going to take a decade or two for some of these devices that have been in environments to get cycled out through, new devices that are being developed, and then new acquisition of those purchased devices by health systems.
Right. Yeah, I think, we're seeing IoT devices or MIoT devices just becoming more commonplace in healthcare, as we're seeing, the model of care, of patient care delivery change from, in hospital, for example, to hospital at home, right? We need those tools to be able to monitor patients when monitoring for chronic care management or, remote patient monitoring. Those tools are invaluable, they're powerful, and they help give us insight to the care of those patients. I think the important thing to note is that when these devices are out there, there's vulnerabilities, right? So many of our clients that are using these types of devices, they depend on us to help them through that process, how to secure those particular devices in this example that I'm giving. So they focus on with us network segmentation, multi-factor authentication, and password policies, the encryption of that data. And we work with them on regular software and firmware updates on all of those devices. Also conducting automated compliance audits, which is very important. Policies change, and we need to make sure that we're keeping up with those particular policies. Endpoint security and access controls, and again, employee training. I keep mentioning that, so it's very important. Continuous real-time monitoring of the system to detect unusual behavior, kind of like a cyber surveillance, if you will, on the back end that's going on continuously. And then an incident response plan. I think these are all things that we're working on with our clients to actually maintain a better posture regarding cybersecurity.
The one thing I want to build upon there, Dr. Q, is that continuous cybersecurity assessment. So many times we think we get to a place, maybe we're an organization that just did a comprehensive multi-factor authentication or segmentation project. But we all know that our IT teams and our clinical informatics teams are doing projects every day, and the ecosystem is never stale. So it's changing all the time. So it's something I advocate for, and a lesson learned from my past is, never think you're done. And just because you completed a project, make sure that you're continually assessing, whether it's vulnerabilities or configuration management within all of these tools and all of these environments. Kind of going back to my old days, we had implemented multi-factor authentication, and because we had done a really comprehensive job there, we had about 35 applications for the organization that had been protected. Well, sometimes having a third party come in and look at those configurations instead of the adversaries doing that for you is really important, because they're always looking for a hole, whether it's, an organization that, first they're going to look at the soft targets that haven't done the implementations at all, but then they're going to move to targets that have implemented, and they're going to look for vulnerabilities. Maybe it's a misconfiguration within your multi-factor authentication tool, or maybe it's a missed subnet that wasn't segmented or protected or has visibility in front of it. So utilizing tools and services from cybersecurity organizations, like WWT and Palo to, really just double check, trust but verify, to make sure that, nothing's missing.
Yeah, you can't go to sleep at the wheel. Nope.
I love that idea of continuous improvement. And we've seen some major breach stories in the news, but health systems have had a lot to juggle really since the pandemic and are doing so admirably. Do either of you have any good client success stories you could share?
Sure. Yeah, no, I think, working with Palo Alto has been wonderful. I mean, they're a great partner. Two that come to mind. So Common Spirit Health, a very large healthcare system in the U.S. WWT, had provided various services, including Palo Alto, regarding onboarding and quarterly health checks for Common Spirit Health. So again, keeping on top of that continuous, environmental assessment for them. So utilizing Palo Alto network cybersecurity solutions such as advanced firewall and cloud-based offerings that they have. That's a big one that we did for Common Spirit. And another one is more on the biopharma space. So GlaxoSmithKline, so GSK. WWT has worked, with GSK, on a Palo Alto lab project that involved various security and network performance topics, including, border gateway protocols, I believe, segmentation, and also next generation firewalls.
Maybe something that I'd like to add there, Jake, is, Wells at Palo, we have great products, great software and hardware technologies that provide visibility and protections, across these organizations. Healthcare customers really expect organizations like WWT, who has a immense amount of experience in healthcare, to come in and really understand, bring experts to the table like Dr. Quinones, that can share what has been done and what good looks like across different health systems. And that's so important. You can have the best technology, the best software or cybersecurity technology, and if the partner doesn't know what they're doing and know the environment they're protecting, it really doesn't matter. So that's something that I've really come to respect about WWT is coming in, deeply understanding what the ecosystem looks like from a healthcare delivery organization or a pharmaceutical company, being able to bring best practices and experience, and moving projects along much faster than maybe traditionally they have in the past.
All right, Troy and Dr. Q, I want you both to take a look into your crystal balls for this next one. But what does the future of healthcare cybersecurity look like? And how do healthcare cybersecurity leaders best prepare?
Yeah, so I think that AI is going to continue to be not only a tool for healthcare organizations to utilize, but anytime there's digital transformation, the adversaries are looking at that transformation, knowing that's the best area to disrupt, because things move so fast. Sometimes cybersecurity lags behind it. So I definitely think adversaries are going to look at that transformation and try to poke holes in it. It shouldn't and won't be any different than any other transformation that's happened in any other industry. They're going to look for gaps in those spaces. I also think that adversaries are going to utilize AI against healthcare organizations to scale. So in 2023, what we saw within our Unit 42 was much more sophisticated attacks, but less attacks. Those attacks were much more successful against larger organizations. I think what we're going to continue to see, and we've already seen this into later 2024, is we're going to start to see better automation of those sophisticated attacks against more and more organizations. We've already started to see that, and that was a prediction that I had in early 2024. So those are the two things from my crystal ball that I would predict for moving into 2025.
Yeah, so Troy has a better crystal ball than I do, but I would say that, yeah, I just think that, it's going to get harder. And what I mean by that, bad actors are well funded. These could be state-backed bad actors or independent, but they're well funded, and they have a lot of time on their hands, and this is all they do. And again, whatever they're raising money for or getting money for, again, that's another subject. But because they have these resources, and they have AI as Troy had mentioned. They're constantly using AI to find vulnerabilities, especially as you mentioned, as healthcare systems are going through transformations. An easy target is somebody who really hasn't gone through, vetting their cybersecurity environment and actually implementing a more, a stronger position in their cybersecurity stance. Now, so that's an easy target, and like you said, they're identifying, they're more efficient, right? So they're finding, instead of going after 10 healthcare systems, they're looking for the easy targets, and they're going after maybe 3, and they're getting a higher hit rate or higher success rate because they're using, advanced analytics to be able to do that. And it's hard to keep up, and why, their advantage is a little bit of our disadvantage when it comes down to healthcare. We don't have the resources that they do in terms of, money. And so we have to be very strategic in how we actually budget for this, but we have to budget for it. So I think we have to do the best we can. I think that they will have an advantage, but we can't, rest our laurels, and we always have to be vigilant at protecting ourselves. So I don't know. I mean, do you feel different, Troy? I'm curious.
No, the one thing I would add there is motivation too. I think there's going to be increased support for these threat actors, and motivation is going to be high because of the unfortunate success that they've had of recently, not only in large attacks that have been highly publicized, but smaller ones. There's been a lot of smaller ones where the adversaries are having success. So I think that success creates motivation, creates funding. So healthcare organizations, I think, certainly know they need to take it very seriously, but it isn't going to get any easier, very much like you said.
I mean, healthcare is hard enough as it is. It's not an easy career, and all we want to do is take care of people. That's all we want to do, And then you have people like this that just uh, so it's an uphill battle, but we fight the good fight, and we continue to forge forward.
Well, that does it for this episode of the Partner Spotlight. And again, I want to thank you both, Troy Amet, Dr. Eric Quinones. Appreciate you taking time out of your schedule to share your insights. And thank you to the viewers that tuned in on WWT.com. If you want to learn more about the WWT and Palo Alto partnership, just visit our website at WWT.com. The partner section has tons of great technology demos, labs, and learning paths around Palo Alto's products and services. And feel free to reach out if you have any questions moving forward. And thank you, and we'll see you next time.